a board-certified obesity medicine physician. This is a doctor that has gone even further in their education, their expertise, their credentialing to become board certified in the disease of obesity. They are now further educated and trained in how to care for patients with the disease of obesity in a much more comprehensive manner. My name is Steph Wagner. I am a registered dietitian. I'm the owner of Bariatric Food Coach, a website that is supporting patients in the everyday life after bariatric surgery, gastric sleeve, gastric bypass, duodenal switch, all of those things. This is kind of a newer area of medicine that is incredibly needed, and we have more access to them. Here in my hometown in Kansas City, we have a wonderful program, Heartland Weight Loss. I'll do a video and review them even more, but if you happen to be in the Kansas City area, definitely check out Dr. Courtney Younglove's program. She has amazing staff, but this is a great example of what might be available. Dr. Younglove is an OBGYN that then continued her education to become board certified in obesity medicine, and then she has physician's assistants, other special trained staff that are highly compassionate and very well educated on how to care for patients living with the disease of obesity. Now, this may be still applicable for a bariatric surgery patient because obesity is a chronic disease. Surgery is a treatment to the disease, but it's ongoing treatment for a chronic disease. Okay, so someone that's had a surgery will continue to follow up with their surgeon, certainly once a year to follow-ups, and definitely for annual lab work. In fact, here's my PSA. If you have not had your annual labs, you're more than a year out, it's been a very long time since you've had those labs done, I will link below a PDF that you can take to your primary care doctor. If you don't have access to your surgeon, that the surgery center closed or you moved or whatever the situation might be, definitely get those labs done or find someone to establish care with. But an obesity medicine doctor is a physician that can care over a more comprehensive view of things. So you still want to have access to your bariatric surgeon for the surgical treatment, the anatomy changes, but obesity medicine can also look at other treatment options. Maybe it is pharmacotherapy or a medication. There's 7 FDA-approved medications, and they can be very safe and effective alongside a gastric sleeve, a gastric bypass, or duodenal switch. And many post-op patients are using medications to maintain or lose more weight, to keep their body fat in a safer range to prevent further obesity-related diseases. So an obesity medicine doctor is going to look at medications that may be promoting weight gain. So they might look at your current list of medications, and there's antidepressants that might increase appetite and make it harder to control appetite and control weight. And they might be able to identify what could be changed. And I've done a previous video on medications that promote weight gain. I'll link that below. They can look at kind of a bigger picture of food environment, access to food, whether you need to work further with a dietitian like myself, or exercise physiology, or a counselor. And they definitely know the ins and outs of medications, which one might be the right fit for you, the right dosage, the correct way to manage the side effects. And this is different than even a primary care doctor that wouldn't have that depth of knowledge. And I've talked to friends, family that have used a primary care doctor to manage obesity medicine, maybe like a GLP-1, and the depth of knowledge is not the same to know what to do with dosing changes or symptoms. And this, because it is a whole specialty, if there's a level of board certified, credentialing, then it's not simple. Same is true for going online. It's hard to get that level of time and attention if you go online, and there's not safety with these compounded medications. They are not FDA approved. And so going to a board certified obesity medicine specialist means that we're going to work with doctors that know what is safe, what is effective, what's appropriate. So I've talked to Dr. Younglove's staff, what makes an obesity medicine clinic like yours the place to go to manage obesity. And they all said it's the time and the expertise. We can really sit down and talk through your situation and what's unique about you. And specifically for Dr. Younglove, she's an OBGYN that then became board certified obesity medicine. So they're certainly looking at the menopause transition and obesity in women and looking at a lot of these different hormones and factors that promote weight gain. And that's something that is simply difficult to get into with your primary care, annual visits. How do you find an obesity medicine doctor? One way is to go to obesitymedicine.org and click the Find a Provider option, and you can put in your zip code. That's a great way to get started, and then go from there. Check out their websites, ask around, look for reviews, get started. I certainly know about options in my home state in Kansas. I know of a great option in Missouri that offers virtual options. So sometimes finding the right provider is just getting started, but I think it's a great way to keep going and go further to find what kind of comprehensive care for ongoing treatment. It's no longer just have your surgery, visit a surgeon once a year, and you're on your own. Thankfully, the field of medicine related to obesity treatment has grown and is growing, and I am here for it. Hey, for ongoing help with the day in and the day out for eating, I'm your girl. If you like free recipes, hop on my email list. I send at least 2 free recipes every single week. I send what's on my menu. Also, videos like this and product reviews and more. Check out the link below for a free menu and get on that email list.